Hello. So I'm super nervous. I don't know if you could tell, but I'm very nervous to share this. And the funny thing is about this speech is that last night my neighbor, he's an addictions counselor, was the one who was helping me with this. So it's quite ironic. My name is Rachynski. I'm 33 years old. I'm a mom. I'm a wife. I'm a daughter. I'm an aunt. I am a kids yoga teacher. I work for Alberta Health Services full-time, and I'm a cannabis user as well. And so my other side, I am a sick person, and I am a survivor. So I'll share those stories with you. I'm from the Kootenays, so I'm from Calgary, BC. If anyone's familiar with the Kootenays, there's more marijuana going around than pretty much the MMR vaccine, so that's Nelson for you. And so yes, I did try it occasionally as a teenager growing up, and I'm pretty sure whatever I used was an herb from someone's spice cupboard, but it was marijuana to me. And then I moved to Calgary, and I still was using it occasionally. And I ended up, I went to a Def Leppard concert, and I may have consumed more than I thought I could and couldn't hear the music or feel my legs. So after that, I was done with marijuana, and it scared me, and I was nervous to use it, and I had my own stigma created about it. And the funny thing is that my husband, he's used it since the day I've met him. And so after I stopped using it, I was super hard on him. I was angry with him for using it, and I didn't want him to be around the kids when he used it, or smell like it, or have any of the stuff around our house. And so I really had my own stigma about it for sure. And so I wish my husband was here. I would apologize to him. I'm sorry, Tim. But I want to go back a few years. So I was 19 years old, and I'm the small town girl living in Calgary, and I am experiencing this big city life. And so I would go out with friends to clubs and, consume some beverages and meet new people. And one day when I was at a club, I was going to the bathroom, and I was pushed into the stall and raped in the bathroom. And then he left, and that was that. And so I went and told a friend what happened, and it was her friend that did it. And she told me that I was lying, and it didn't happen, and I was the cause of it. Sorry. And so after that, it's amazing what you can really put down deep inside of yourself when you just want it to go away, or you don't realize it was as bad as it really was, right? And now fast forward to a year ago, I was triggered. I saw this girl at a restaurant. She was serving me, actually, and after seeing her for the first time since then, I was just triggered like it happened the day before, and all of these memories just went into my head, and the looks of people's faces when I came out of the bathroom stall, and just everything came flying back at me, and I didn't really know how to deal with it. And so I went into depression. I had major anxiety. I had trust issues. I had to take time off work because I was just a mess. And then from that stress, I don't know, I know there's lots of physicians in here. I don't know what your say is on this, but I really do feel like the stress that I felt at that time was a huge contributor to the fibromyalgia that I was just diagnosed with in January. And so, and now with the fibromyalgia pain mixed in with the PTSD, it was pretty awful. So feeling all this pain in my body, I didn't know what to do with it. And of course, fibromyalgia and a sex assault victim are two huge stigmatized things in this world, really. It's not a real illness, or that's just how I've felt. So, and then after finally being diagnosed with fibromyalgia, I was put on Cymbalta and Lyrica, and I don't know if you've ever seen the commercials for those, but the Cymbalta, it's pretty much like side effects are you will die or have anal leakage or like it's awful stuff. Liver failure. Like, why are we being put on this stuff if that's the side effect? And for marijuana, I can just imagine, will cause munchies, dry mouth, and possibly a long nap. Like, right? Like, what else? And to me, it just makes sense. Like, why would this be the first thing that we or put patients on, are these medications that we don't even know work? It's really, we don't know if it works. And so the Cymbalta didn't work. And so the Lyrica is what I was put on after. And it's also not working. And so then comes along the marijuana. So my husband talked me into trying it one day because I was just in so much pain. And for the first time in a year, I felt no pain in my body instantly. It was instantly. I felt anxiety lift away from me. I felt happy. I felt like myself. I didn't feel like the sick person anymore. I felt like Holly. And instantly, I have to say, with my path to find it, I never had issues getting my prescription, so I was very lucky to be able to find natural health services right away and get my prescription. But the worst part is, of course, with my physician. So I'm obviously a frequent flyer in the clinic. So the day I told him I was using it, he just kind of went, okay, and then he moved on. Like, it wasn't anything. We didn't talk about it anymore. He didn't make note of it. It was just something I told him. He instantly moved past it because it made him uncomfortable. So, and to me, that felt like there was no support. I kind of lost trust in my whole care. There's no connection. And so, to me, I feel like that would be one of the biggest things in the future, is for that family doctor to be able to connect with that patient and to be able to accept that that medication is actually medication. Yeah, and so, sorry. Where am I? And so I want to kind of read the definition of stigma. And I want you to sit with it for a minute. So the definition is a mark of disgrace associated with a particular circumstance, quality, or person. So when I hear that, it makes me really sad because there's a disgrace upon me because I'm feeling better, because I'm not sick when I use it, because I'm the dirty pothead. Like, it's just, it's not fair for that. I really hate that word, the stigma word. So anyways, I can say that the marijuana has definitely improved, and I have found support. Any of the Calgary Cannabis, I think it's you guys, Calgary Cannabis Club? Are you guys, whoever's here, claps, stand up, I don't know. There's been huge support through them. On Facebook, they have a page, and any questions that someone has, they know. I swear to God, they know better than a physician would. So anyways, thank you to those people that are here. And thank you for listening to my story. I'm done now. So.